Okay, so the cardiovascular system obviously can be improved, and whether we're looking at just sedentary people beginning exercise for the first time, or whether we're looking at regular athletes trying to improve their performance, you just need to know how physiologically the cardiovascular system can adapt in response to endurance training. And it might involve the endurance training we're talking about could be at any level, can be any form, so it could be running, walking, or riding, swimming. And obviously, the level at which you pitch the intensity of the activities needs to be appropriate to the performer we're talking about, whether it is an inactive person or somebody who is very, very sporty. But essentially, endurance activities are activities which involve you working at a submaximal level, working at a moderate intensity, which you can keep doing for quite a prolonged period of time. So it needs to be below the level which we call OBLA, onset of blood lactate accumulation. Now, lactate accumulates at higher intensity work when you're working anaerobically. So if we're working below that point, below the anaerobic threshold, we're working around about 60 to 85% of your maximum heart rate. And you should know that maximum heart rate is 220 minus your age. So it's kind of the middle range. Obviously, this heart rate value would be very different for experienced and trained or untrained athletes. So we're looking for aerobic work, submaximal work. If you work higher, the upper end of that or higher than that, you have aerobic adaptations, which can improve how efficient your cardiovascular system works to circulate oxygen and remove waste products. And again, if you work at the higher level, the upper end of this submaximal intensity, you'll basically be even more protected against coronary heart disease. So working below that might not get you these benefits. Working at the upper end of that will get you even more either physiological performance improvement or health protection, if you like. Again, just to revisit what type of physical activities might it be, we've got our standard recommended intensity, so adults doing 3 to 5 sessions a week of about 30 minutes, moderate level intensity, we've just said aerobic submaximal work, and children an hour a day. So what kind of adaptations may take place? So let's look at firstly the heart specifically. Remember, cardiovascular means heart and vessels, so we're just going to look at the heart adaptations to start with. Now, endurance activities challenging your heart, stressing your heart more than it's normally used to, can bring about cardiac hypertrophy. In the same way your skeletal muscles get thicker and your fibres get thicker, so can your cardiac fibres. And that thickening of the myocardium is called cardiac hypertrophy. And now we know that if your heart is stronger, the walls are thicker, then it can contract more powerfully. And if it does that, the chances are your stroke volume will also increase, and there's some values there. So you might increase by sort of 50 or 60 millilitres at rest, and even more substantially during exercise. And if your stroke volume goes up, then we can circulate more blood. If your heart fills very well, you have a good venous return, it could be that you have a larger volume of EDV, end diastolic volume, which it actually will also lead to greater stretch of the cardiac fibres and an increase in stroke volume. If we're contracting more powerfully because our heart is stronger, we can also eject more blood, so we've got our increased stroke volume. And if more is being ejected, a greater proportion, then our ESV might be reduced. We might be left with less blood in the heart at the end of the contraction phase. Ultimately then, if we've got a stronger heart contracting more forcefully, we can increase cardiac output. So we might increase the volume of blood, the litres that we're ejecting out of the heart per minute, maybe up to 40 litres per minute. If we're able to increase stroke volume, we might be able to decrease resting heart rate. So we might not have to make our heart beat as many times if we're ejecting more each time it does contract. And actually, if you have a heart rate which is below 60 beats per minute consistently, that's called bradycardia. And we often know that if you are considered a fitter person, it's because you have a lower heart rate, a lower resting or a lower working heart rate. So bradycardia is a good thing. And at the end of all of this, all of these factors will contribute to a healthier heart and a more efficient heart in terms of aerobic performance. So what about blood vessel adaptations? Well, we can reduce blood pressure. We can have greater capillarization. So this means more capillaries are around the alveoli and around the muscle cells. And you should know that capillaries is where gas exchange occurs. If we've got more capillaries, we can have more gas exchange, more oxygen getting into the blood and more oxygen getting into the working muscles and more carbon dioxide being removed into the blood and away into the alveoli. The arterial walls might be more elasticated, so this will ultimately allow us to vasoconstrict and vasodilate better. And if we can do those things, if we have better vasomotor control, we can shunt the blood to different places more effectively. So our vascular shunt mechanism might be improved. We might have greater blood volume circulating in our vessels. And obviously, if you've got greater volume, you might have more red blood cells within it. And if you have more red blood cells, you have greater oxygen carrying potential because you'll have a greater hemoglobin density. Again, greater blood volume, greater hemoglobin means that we can deliver more oxygen to our working muscles, and the muscle cells can use that to make energy. And if we can use aerobic sources to make energy for longer, we can delay OBLA. We can delay the need to rely on anaerobic sources and the buildup of lactic acid, which we know will ultimately fatigue us. So overall, if we can increase the supply of oxygen to our muscle cells and use more oxygen per minute, we can increase the volume of oxygen that we can use per minute, and that is VO2 max. However, if you do suffer from coronary heart disease, you shouldn't take part in endurance activities, you shouldn't stress your body, because ultimately your blood pressure might increase to dangerous levels, and with that you might have increased risk of angina and heart attack. So obviously exercise is exceptionally good for preventing coronary heart disease, for training your heart and your blood vessels to provide oxygen better. But if you do suffer from coronary heart disease, you should avoid this kind of activity and certainly see medical attention.